The management of older patients, and in particular of older patients with cancer, is a complex issue. As you say, there are two words that unfortunately are often used together. Complicated derives from the Latin complicare. It means to fold. Something which is folded is easily unfolded. Complex derives from the Latin complexere, which means to weave together. And if you have, like a carpet, if you have a carpet with a faulty design, you may not be able to correct the design without unweaving the carpet. I think that we don't have yet a solution for a complex situation. We have studied a lot of complicated situations in clinical trials, but what we face in our daily practice are the complex situations. There are a number of ways in which one can approach this problem, however. The first way is to establish a person's risk of cancer unrelated mortality. And there are systems to do that based on geriatric assessment, polymorbidity, and obviously if a person is unlikely to live long enough to suffer from the cancer, that is already a good screening test. I called it mortality, cancer-unrelated mortality risk, because it's not just a matter of term. What we really assess is the risk of mortality, which is the inverse of life expectancy. But anyway, that's okay. It will change mainly in the issues of in the field of adjuvant treatment of breast cancer, or lung cancer, or colon cancer. In other words, when the effects of the treatment are on a long range. When the effects of the treatment are in a short range, that generally does not affect it too much. It is not. The NCCN guideline do recommend that all cancer patients aged 70 and older undergo some form of geriatric assessment to estimate life expectancy and risk of toxicity, but that's as far as the guidelines go. Having said that, there is an online program called ePrognosis that provides a number of instruments to assess the risk of mortality. So I think that combining this full assessment of the older patients with the instruments provided by online may lead at a good approximation of a person's life expectancy. As I said, I don't have a magic formula, but I think that there are common sense ways, combined with the increased knowledge of geriatrics, to approach this problem. Let me give you an example. Right now I have a lady with breast cancer, chronic myelogenous leukemia, a stroke, and probably recurrent colon cancer. And obviously the question came, how should we treat the breast cancer? How should we treat the chronic myelogenous leukemia? And there are some, first of all, one way to approach this is obviously to study this lady's life expectancy. The second approach is to see which one would be the most effective means to treat these things. For example, in this case, for the breast cancer, surgery would be the most effective means, but is really necessary in a patient who has a stroke and has other diseases. And when you based on the life expectancy, you see that that is probably not necessary. So, you know, you have to kind of unravel this mass of information. Curative, cure whenever it is possible, healing always, But I would say in the prolongation of survival is very important, but in older person there is something which is even more important, and that is prolongation of active life expectancy. Prolongation of the period of time, prevention of any further functional deterioration. I would say that it's very important to assess each person's life expectancy, each person's risk of toxicity from the treatment, be that surgical or medical or radiation. And after that, to see what are the expected outcomes from this treatment. And the outcomes are cure, prolongation of survival, symptom palliation is true for all patients, but in older patients you have to add prolongation of active life expectancy. In other words, prevention of functional deterioration. I would just recommend to assess continuously the effect of the treatment on the function of the patient, and if there is some evidence of functional deterioration, to discuss with the patient very seriously if it is worthwhile to continue this type of treatment.